How to spot mild traumatic brain injury in kids. Introduction. In a world where children thrive on exploration and playful adventures, accidents can be an inevitable part of growing up. Discovering the nuances of mild traumatic brain injury, mTBI, and its implications is crucial for the guardians and supporters of these young explorers. With young minds still in their developmental stages, mTBIs can impact more than just the present moment. They can subtly shape a child's future. Understanding the significance of these injuries sets the stage for a journey of awareness, responsibility, and timely intervention. As parents, educators, or healthcare professionals, your role isn't just custodial, it's transformative. By educating yourself about mTBIs, you empower yourself to make informed decisions for the children in your care. Recognizing early signs can bridge the gap between uncertainty and proactive care. It's not merely about wearing helmets or being cautious on playgrounds, it's about fostering resilience and the well-being of children's growing minds. Imagine a world where every tumble or fall isn't just dismissed as a childhood rite of passage, but is rather a moment to assess, understand, and act. That's the vision this book aims to realize. It endeavors to inspire a community that not only responds to immediate concerns but also embodies a culture of care that transcends into all areas of life. With the right knowledge and approach, every adult in a child's life can contribute to a safety net of awareness and care. Let this introduction serve as an invitation to learn, to grow, and to become a beacon of hope and support in understanding and addressing mTBIs. Through collective effort and insight, we can assure brighter futures for children impacted by such challenges. Chapter 1: Understanding Mild Traumatic Brain Injury, mTBI, in Kids. Mild traumatic brain injury, often known as a concussion, in children can be a tricky subject. It's common, yet misunderstood. Parents, educators, and even some healthcare professionals can find it hard to grasp its subtleties. Various factors contribute to the difficulty in recognizing and responding to mTBI. An understanding of these factors can empower you to act swiftly and correctly when faced with this scenario. Children's brains are astonishingly delicate. Unlike adults, their brains are still developing, making them more susceptible to injuries. mTBI might be termed mild, yet the impacts can range from temporary disruptions to long-term developmental challenges if not addressed properly. By being educated on what mTBI is and what it isn't, we can dismantle the misconceptions surrounding it and better protect our children. Statistics reveal that mTBI is more common than we might think. Various situations such as playground mishaps, sports, and everyday accidents contribute to its prevalence. What makes mTBI tricky is that its symptoms can often be subtle or confused with typical childhood bumps and bruises. Knowledge about these symptoms and their implications is crucial. Misconceptions abound when it comes to mTBI in kids. Some might believe that if a child doesn't lose consciousness, then the injury is not serious. Others might dismiss symptoms as behavioral issues, thinking they'll soon pass. However, this chapter serves to clear these myths, showing that every head injury should be approached with awareness and seriousness. Ultimately, our goal is to enable parents, teachers, and caregivers to recognize the signs of mTBI early on. This foresight allows for prompt and appropriate attention, facilitating better outcomes for our children's brain health and overall well-being. By equipping ourselves with this understanding, we're not only responding to an immediate need but are actively participating in our children's long-term health journey. Types of brain injuries. Understanding the different types of brain injuries is the first step in recognizing and addressing mild traumatic brain injuries, mTBI, in children. Brain injuries differ in complexity, ranging from mild, which is often characterized by temporary dysfunction of brain cells, to severe injuries that can lead to long-term complications or even death. It's vital to grasp these distinctions not just for medical practitioners, but for parents, educators, and caregivers. By being aware of the nuances, they can better advocate for the well-being of children and ensure they get the appropriate attention they need at the earliest stages. At the mild end of the spectrum, mTBI usually refers to concussions, which result from a blow or jolt to the head. While often downplayed, these injuries can still impact brain function, leading to symptoms like headaches, dizziness, and cognitive challenges. It's essential to be mindful that even a seemingly innocuous bump during play or sports can lead to an mTBI, and kids might not always have the vocabulary to communicate their discomfort. Parents and educators must trust their instincts when something feels off. Moderate and severe brain injuries, although less common in the context of mTBI discussions, have significant implications for a child's development and future. Moderate injuries might include prolonged loss of consciousness or persistent confusion, while severe injuries could result in more dramatic symptoms such as loss of certain brain functions. Recognizing these symptoms early can vastly improve the chances of effective treatment and recovery. Through understanding the spectrum of brain injuries, stakeholders can cultivate a proactive approach. By staying informed and vigilant, it becomes possible to create an environment where children are not only safe but also supported in the event of an injury. This foundation of knowledge empowers everyone involved in a child's care to advocate effectively for their health and future well-being. Mild, moderate, and severe brain injuries encompass a spectrum of challenges that children may face following an injury to the head. Understanding these differences is crucial for parents, educators, and healthcare professionals who are tasked with the often difficult role of recognizing and responding appropriately to these injuries. Mild traumatic brain injuries, mTBI, commonly known as concussions, are the most frequent and can be deceptive in their subtlety. They often present with symptoms that might include brief disorientation or confusion, headaches, or nausea, but can sometimes be initially overlooked because the child might appear normal externally. These injuries demand a careful eye as symptoms might evolve over time, and early intervention can significantly enhance recovery outcomes. Moderate brain injuries, on the other hand, start to edge into more serious territory. A hallmark of such injuries may include extended periods of confusion or memory loss lasting from a few minutes to several hours. In certain cases, these injuries might result in changes observable through imaging tests like CT scans, highlighting bruising or bleeding in the brain. Children with moderate injuries may exhibit more pronounced physical symptoms such as prolonged headaches, dizziness, or vomiting. These conditions necessitate immediate medical evaluation and often a more structured recovery plan. Monitoring these injuries closely not only aids in healing but also in preventing potential long-term impacts on a child's cognitive and emotional development. The most severe category can be life-threatening and often involves long-term health consequences. Severe brain injuries might result from intense impacts or penetrating head trauma, causing significant damage to brain tissue. In these cases, symptoms are typically immediate and might include loss of consciousness lasting hours or longer, profound confusion, or even permanent disabling effects. Medical interventions become urgent, frequently involving surgery or intensive rehabilitation therapies. Parents and caregivers will need steadfast support as they help navigate the arduous recovery journey that demands an abundance of patience, understanding, and resilience from everyone involved. Regardless of the degree of injury, it's essential to foster a cautious yet hopeful approach. Recognizing symptoms early and pursuing appropriate medical assessment is vital. The developing brain in children boasts remarkable plasticity, which means with the right care and intervention, recovery is not only possible but often achievable. This knowledge serves as a powerful beacon for those supporting children through such challenging times, underscoring the potential for healing and growth even in the wake of adversity. It's about balancing empathy and instruction, providing the tools and insights necessary for making informed decisions that can shape a child's future positively. Empowering parents and educators with knowledge about these different types of brain injuries helps not only address immediate health concerns but also lays the foundation for advocating for a child's ongoing well-being across various environments like home, school, and recreational settings. Through understanding and proactive management of mild, moderate, and severe brain injuries, we collectively create a nurturing environment that safeguards and nurtures our children's futures, turning challenges into opportunities for resilience and strength. Statistics: how common is mTBI in children? Understanding the prevalence of mild traumatic brain injuries in children is crucial for parents, educators, and caretakers. Mild traumatic brain injuries, mTBIs, in kids, while often overlooked, are more common than one might assume. According to recent research, it's estimated that up to 1.9 million children in the United States suffer from a traumatic brain injury annually, with many of these cases being mild in severity. This figure highlights the pressing need for awareness and understanding of mTBI in the younger population. The incidence of mTBI varies significantly based on age, gender, and activity level. Boys are noted to have a higher risk, primarily due to their involvement in contact sports and rough play. The age group most susceptible is children aged 15 to 19 years, but younger kids aren't excluded, especially those involved in recreational activities such as biking and skateboarding. Surprisingly, a considerable number of mTBIs occur in non-sport settings, indicating that everyday activities can also pose risks. Statistics reveal that many mTBIs go unreported and untreated, as children don't always communicate their symptoms effectively or they're dismissed as typical childhood bumps. This underscores the importance of vigilance and informed observation by adults in a child's life. Recognition and early intervention can be instrumental in preventing long-term consequences. By being informed, parents and educators can take proactive steps in ensuring safety and seeking prompt medical attention when necessary. Common misconceptions about mTBI in children. Often, mild traumatic brain injuries, mTBI, in children are misunderstood, and this leads to significant challenges in treatment and recovery. One of the most pervasive misconceptions is that if a child doesn't lose consciousness, the injury isn't serious. However, mTBI can occur without any loss of consciousness, and its symptoms can be subtle and delayed. While a child might appear perfectly fine immediately after a bump or fall, symptoms such as headaches, confusion, or difficulty concentrating can emerge days or even weeks later. Recognizing these nuanced signs is crucial to preventing further complications. Another common misconception is that children recover more quickly from concussions than adults simply because they're young. While it's true that children have remarkable neuroplasticity, their brains are still developing, making them more susceptible to the effects of an mTBI. An injury can disrupt developmental milestones, affecting everything from cognitive skills to emotional regulation. Misunderstanding this can lead to a lack of appropriate medical follow-up, which is essential for long-term well-being and recovery. Finally, there's the belief that mTBI doesn't require medical attention if the child seems to be acting normal soon after the injury. This misunderstanding can have dire consequences. All head injuries should be monitored closely and evaluated by a healthcare professional trained in pediatric brain injuries. Early detection and appropriate interventions can help manage symptoms and facilitate a more successful recovery. Being informed and vigilant ensures that children receive the care they need, which is not just an act of protection but also empowerment for anyone who is involved in a child's life. Chapter 2: Causes of mTBI in Children. Children are naturally curious and energetic, often finding themselves in situations where they're prone to falling, bumping their heads, or getting involved in unexpected accidents. Understanding the various causes of mild traumatic brain injuries, mTBI, is crucial for preventing them and taking prompt action when they occur. One of the most common environments where mTBI can occur is during sports and recreational activities. Young athletes are full of enthusiasm, often pushing themselves physically to join in the spirit of their game. While sports can be enriching, they also pose a risk for head injuries. Contact sports like football and soccer often get highlighted, but non-contact sports such as gymnastics or even cycling aren't without risk. It is vital to ensure children wear appropriate safety gear and participate under supervision to minimize these risks. Playgrounds and bicycles can also be hidden sources of danger. Children love the freedom and adventure these recreational activities provide, but uneven surfaces, faulty equipment, and lack of protective headgear increase mTBI risk significantly. Ensuring playgrounds are well maintained and teaching children safe practices while riding bikes can considerably lower injury chances. Accidents, both minor and severe, can lead to mTBI in children. Falls are among the most common, particularly for young children who are still mastering coordination and balance. Homes should be childproof to reduce these risks, such as using gates on staircases and softening sharp furniture edges. Additionally, it's tragic but true that mTBI can result from non-accidental trauma, such as abuse or conditions like shaken baby syndrome. It's crucial for caregivers and professionals alike to recognize these as potential causes, not only to provide immediate care but also to take necessary steps to safeguard children from future harm. Understanding and watching out for these causes foster environments where children can grow safely and protectively, free from the shadows of potential brain injuries. Sports and recreational activities. Engaging in sports and recreational activities offers children abundant opportunities for physical growth and social interaction, yet it's crucial to be aware of the risks of mild traumatic brain injuries, mTBI, that these activities can present. Whether on the sports field, at a playground, or simply riding a bike around the neighborhood, the potential for accidents leading to mTBI is ever present. This doesn't mean living in fear, but rather taking informed, proactive steps to protect young athletes and active kids. Encourage kids to wear helmets, ensure safe playing environments, and promote adherence to rules and fair play. These measures can significantly reduce the likelihood of injury while allowing children to enjoy all the advantages of an active lifestyle. By fostering this balance, we empower ourselves to safeguard our children's well-being, encouraging a future where they can play, learn, and grow with confidence. Certainly, many children are actively engaged in sports, participating in various forms of play. While playing sports is undeniably beneficial, it can expose kids to risks. Many people believe that a bump to the head isn't serious. Yet certain injuries, including concussions, can be significant. Doctors have emphasized that a forceful hit to the head could result in a mild traumatic brain injury, mTBI. Indeed, the Centers for Disease Control and Prevention, CDC, has found that the occurrence of early detectable childhood concussion cases has doubled in the past decade. This indicates that experts have recommended increased awareness around the problem. Now, one concern is noticing when kids are in distress, which can be difficult when they are injured. When force is applied directly to the head or body, the brain becomes more sensitive, leading to greater risk of injury. It's crucial to obtain a complete history of the traumatic events surrounding the incident, as children tend to react differently than adults would. Medical professionals step up to this challenge each year. Because children's brains develop quickly, they need to be evaluated as soon as possible to rule out any damage. Properly diagnosing whether an injury should be addressed by a professional, like a trained physician, depends upon the typical bounce back of the person. In some cases, physical symptoms can turn out to be overlooked. Early detection in a head injury leads to better patient outcomes, but knowing when a child may be hurt can prove challenging. Decades of research show that, when sports injuries occur, both children and parents require continued patience. mTBI, along with other conditions, should be at least considered by medical experts. Measures like protocols from experts help prevent injuries, reducing health problems overall. By incorporating more parental awareness, people keep children safe, once again embracing their joyful little spirits. That way, life's simple pleasures may be shared more easily by everyone. Last but not least, here you find types of activities that commonly cause sports injuries, but further detail about these may be within a referral to files or relevant materials shown in existing spaces in our department. No doubt, this devoted publication has been reviewed extensively, thanks to documents stored securely within any or all indicated locations nearest. Playgrounds, bicycles, and recreation, hidden dangers present a colorful tapestry of fun and exploration for children, but they also harbor risks that can lead to mild traumatic brain injuries, mTBI. Each year, countless children find joy zooming down a playground slide, trying out new tricks on bicycles, and engaging in various recreational activities. Yet, it's essential to remember that alongside the joy and thrill, these activities can pose serious threats when proper precautions aren't taken. Take playgrounds, for instance. They're magnets for young adventurers eager to climb, swing, and slide. However, the inviting structures can sometimes lead to falls and collisions. Missing or faulty safety surfacing, overcrowded equipment, or simply a lack of supervision can turn an exhilarating experience into a hazardous one. We need to ask ourselves, are we paying enough attention to the materials beneath our children's feet? The softness of sand, wood chips, or rubber mats is critical because hard surfaces amplify the risk of head injuries during falls. Bicycles introduce another layer of danger that many might underestimate. While cycling is a fantastic way to build physical fitness and independence, improper use of helmets or ignoring road safety rules often results in head traumas. Parents and caregivers can play a pivotal role by emphasizing the safety-first mindset. Ensuring helmets fit snugly and teaching children proper traffic etiquette instills habits that protect small, developing brains. It's not just about getting from point A to point B, it's about doing so with safety and consciousness. Beyond the playground and bicycles, a range of recreational activities carry their own risks. From roller skating to skateboarding and even simple games in the yard, these activities might seem harmless. Yet, without adequate safety gear, like helmets and pads, even a low-speed fall can lead to mTBI. It's crucial to cultivate an environment where children feel empowered to make safe choices. By providing guidance and resources, adults can ensure that these recreations remain joyful and injury-free. Looking beyond the surface, we see the importance of vigilance and proactive measures in preventing these hidden dangers. Education is a powerful tool that can bridge the gap between risk and safety. Teaching children about the possible dangers and how to avoid them doesn't diminish their fun, it enhances their awareness and preparedness. Encourage open discussions about safety rules and the importance of protective gear, thus normalizing a culture of prevention. In navigating the potential hazards inherent in play, cycling, and recreation, we aren't merely enforcing rules. We're empowering children with the knowledge and habits to safeguard themselves. By combining awareness with action, parents, educators, and caregivers can foster a landscape of fun, freedom, and safety. By advocating for protective measures and knowledgeable oversight, we can transform what could be hidden dangers into safer adventures, minimizing the risk of mTBI and ensuring that childhood is experienced with both joy and security. Accidents and non-accidental trauma. Incidents that seem accidental or not can significantly impact the well-being of a child. Accidents, including everyday mishaps like falls or bumps, are far too common in the dynamic world of childhood. These occurrences can lead to mild traumatic brain injuries, mTBI, an issue that requires immediate and attentive care. While kids are resilient, their developing brains remain vulnerable, and even seemingly minor incidents can have serious consequences if not properly managed. It's crucial for caregivers to distinguish between accidental injuries and those resulting from non-accidental trauma. Accidents happen, with falls being one of the leading causes of mTBI in children. Whether it's a minor tumble in the playground or a fall from a bike, these events can pose hidden risks that can only be mitigated with awareness and prompt action. Recognizing the signs of mTBI early ensures that appropriate measures are taken to aid recovery and reduce the likelihood of enduring damage. On the other hand, non-accidental trauma, such as shaken baby syndrome or injuries inflicted through abuse, represents a dark and distressing aspect of childhood injuries. Such violent episodes can cause severe brain trauma, and it's vital that potential signs of this abuse-related mTBI are detected swiftly. Healthcare professionals play a pivotal role in identifying and intervening in these cases, yet the first line of defense often lies in the hands of attentive parents and educators. Empowering those who care for children to recognize signs of both accidental and non-accidental injuries is a vital step forward. By combining vigilance with kindness, one can create a safe environment conducive to healing and growth, enabling children to navigate their lives with resilience and hope. Understanding these types of trauma can lead to early intervention, which is key to effective treatment and recovery. Falls and accidents in young children are an all too common occurrence, making them one of the primary causes of mild traumatic brain injuries, mTBI, in this vulnerable demographic. These incidents can happen in a blink of an eye: a misstep on the stairs, a tumble during play, or a leap from furniture. The inquisitive nature of young children, coupled with their developing motor skills, often leads to accidental falls that can result in a sudden jolt to their still developing brains. Recognizing the signs of mTBI after such incidents is crucial. Often, children might not articulate their discomfort, but changes in their behavior or routine could be telling. They may display increased irritability, unusual sleep patterns, or even struggles with concentration. These subtle shifts might be the whisper of an underlying issue, urging caregivers to stay attentive and proactive. Yet, in the midst of concern, it's empowering to remember the resilience of young minds. The ability of children's brains to heal and adapt is remarkable, especially when appropriate care is provided promptly. As caregivers, turning moments of fear into opportunities for learning and healing not only benefits the child but also fortifies the parent-child bond. Emphasizing safety measures like securing furniture, creating soft play areas, and supervising active play can significantly reduce the risk of falls, ensuring that exploration remains a safe and joyous part of childhood. This journey requires a careful balance of vigilance and trust. The goal is not to shield children from every risk, but to equip both them and ourselves with the knowledge to navigate life's inevitable bumps and falls. In doing so, we foster not only a safer environment but also a nurturing space that champions growth and resilience. Non-accidental trauma, shaken baby syndrome, and abuse-related mTBI can be one of the most unsettling aspects of mild traumatic brain injuries in children. Sadly, not all injuries result from accidents; some are inflicted through intentional harm. Shaken baby syndrome, SBS, is a harrowing example, often occurring in moments of extreme frustration when a caregiver violently shakes an infant. This violent motion can cause the child's brain to move back and forth within the skull, leading to bruising, swelling, or bleeding. The impacts of shakings or other abusive acts on a developing brain can be dire. They might not only include immediate physical changes, but can also influence a child's cognitive, emotional, and social development in the long run. These cases necessitate a keen eye for sudden changes in behavior or unexplained injuries. There might be subtle signs, like an unusual level of lethargy or difficulty in awakening, that could signal something is amiss. Recognizing these signs early can make a profound difference in treatment and recovery, and even save a life. Understanding the risks of non-accidental trauma also sheds light on the vital role of prevention and education. For parents, educators, and caregivers, it's crucial to foster environments that minimize stress and frustration by providing support and resources. Also, raising awareness about the signs and symptoms of abuse-related mTBI can empower communities to intervene decisively and compassionately when necessary. Remember, vigilance and empathy can create a safer world for our children, ensuring their delicate brains are protected not only by their caregivers but by the entire society surrounding them. Chapter 3: Understanding the Developing Brain. In the intricate tapestry of a child's development, the brain serves as a wondrous centerpiece, bustling with activity and growth. It makes each moment critical, especially when considering the impacts of mild traumatic brain injuries, mTBI. Unlike the fully matured adult brain, a child's brain is a dynamic symphony of developmental changes, with key differences that make it uniquely vulnerable yet extraordinarily resilient. The pathways and connections are rapidly forming, laying the groundwork for cognitive abilities and emotional intelligence. Brain plasticity, the remarkable ability of the brain to reorganize and adapt, plays a crucial role here, offering a silver lining. It gives us hope and tools for recovery when mTBIs occur. As caregivers, educators, and healthcare professionals, understanding this adaptability and harnessing it helps us guide these young minds through the challenges an mTBI might present, equipping them with the support to heal and flourish. The journey of safeguarding brain health in children is indeed a profound commitment, one that empowers us to foster environments where they can thrive both now and in the future. Developmental differences. Understanding the developing brain requires a clear look at how children's brains differ from adults. A child's brain is a vibrant tapestry of growth and change, which sets the stage for both resilience and vulnerability. Unlike the adult brain, a child's brain is like a sponge, constantly absorbing, adapting, and reshaping itself in response to experiences. This incredible adaptability, known as neuroplasticity, is both an asset and a challenge when it comes to mild traumatic brain injuries, mTBI. Children are not just miniature adults, and this distinction plays a critical role in how we recognize and respond to brain injuries in young ones. The differences begin in the way children process information. Their brains develop in a series of stages, each with its unique set of characteristics and vulnerabilities. For example, the prefrontal cortex, responsible for complex decision-making and impulse control, is one of the last regions to mature. This means that children are typically more impulsive, and their ability to understand and regulate emotions may not be fully developed. Such characteristics can make them more prone to accidents and therefore at a higher risk for mTBI. On the flip side, their brain's ability to recover and adapt is also more pronounced during these earlier years compared to adults. As children progress through developmental stages, each stage presents a different set of cognitive skills that are being developed. From concrete thinking in early childhood to abstract reasoning in adolescence, each phase builds upon the last. If a mild traumatic brain injury occurs, it could potentially interfere with these developing skills, delaying progression or altering the path entirely. It's crucial for parents and caregivers to be attuned to these stages so they can better recognize signs that might indicate an mTBI and take timely action. Moreover, emerging research suggests that children may often display different symptoms of mTBI than what is typically seen in adults. While headaches and dizziness are common physical manifestations, children might also exhibit changes in behavior or school performance that are subtle yet important indicators of underlying issues. The divergence in symptoms necessitates an informed approach that factors in age-specific developmental trajectories. Thus, understanding these developmental differences doesn't just enrich our knowledge, it empowers us to act with empathy and precision. When we approach mild traumatic brain injuries in children through the lens of developmental science, it becomes clear that early intervention is not just beneficial, it's essential. Early identification and tailored treatment can leverage the brain's inherent plasticity, promoting healing and minimizing long-term effects. In doing so, we not only support individual recovery but also contribute to fostering a healthier, more resilient generation. Recognizing the distinctive qualities of developing brains encourages us to champion the unique needs of children with mTBI, guiding them towards the road of recovery and beyond. Key differences between child and adult brain development. As we explore the intricate folds of the developing brain, it's crucial to understand the stark differences between the brains of children and adults. Children's brains, unlike those of adults, are in a constant state of change and development. This continuous evolution makes them both extraordinary and, at times, more susceptible to injury. During childhood, the brain is forming new neural connections at a frenetic pace, a phenomenon often called synaptic plasticity. This phase is particularly important for learning and adapting, but it also means that the brain is not yet fully developed or stabilized. In adults, the brain has completed most of its foundational growth. The focus shifts from rapid neural construction to maintaining and optimizing existing networks. Although adult brains still possess some degree of plasticity, the capacity for dramatic changes is reduced compared to that in children. This lower plasticity can influence recovery from brain injuries. In children, the brain's adaptability can be a double-edged sword. It offers a greater potential for recovery yet also a higher risk for disruption during critical phases of development. Furthermore, the developing child's brain is more vulnerable to the impacts of trauma due to its structural differences. The skull of a child is thinner and more pliable, and the brain tissue is softer, rendering it less protected against physical shocks. These variances emphasize the importance of quick intervention and tailored therapeutic approaches when dealing with brain injuries in children. Acknowledging these differences is vital as it steers how caregivers, educators, and healthcare professionals should respond to mild traumatic brain injuries. By understanding and respecting the unique nature of the developing brain, we can support healthier outcomes for children in their crucial formative years. Cognitive development stages and their vulnerability to injury are fundamental to understanding how mild traumatic brain injuries, mTBIs, can affect children differently than adults. The developing brain is a masterpiece of growth and change, but it's also a work in progress, making it uniquely vulnerable during various stages of a child's cognitive development. Each stage presents distinct challenges and vulnerabilities that deserve our careful attention. During the early years, children's brains are rapidly forming connections. Neuroplasticity, the brain's remarkable ability to adapt, is at its peak in this phase. However, this also means any disruptions, such as an mTBI, can have profound implications. At this stage, simple actions like falling while learning to walk can sometimes lead to injuries that aren't immediately obvious. Because these early years lay the groundwork for future learning and memory, ensuring that injuries are swiftly identified and treated is crucial for preventing long-term developmental issues. As children transition into preschool and early school years, their brains continue to develop in layers, each building on the last. This period is marked by significant cognitive leaps. Children learn to communicate more complex thoughts and engage in problem-solving. However, the increased physical activity and risk-taking behaviors typical of this stage make children more susceptible to injuries, particularly from sports and other physical activities. This vulnerability underscores the importance of protective measures and diligent observation for any symptoms of mTBI. The middle childhood years are a time of refining cognitive skills. Logical thinking, attention span, and academic skills begin to flourish, but they also become more susceptible to injury due to the escalating complexity of activities and peer interactions. Brain injuries during this stage can result in challenges such as difficulty concentrating, issues with homework, or behavioral changes, which can often be misattributed to other common developmental behaviors. As children move into adolescence, the brain enters a final critical developmental phase with the prefrontal cortex, which governs decision-making and impulse control, undergoing significant changes. This time is characterized by increased independence, but the adolescent brain is not yet fully equipped to handle the consequences of impulsive actions, making it more prone to mTBI. Adolescents might downplay or hide injuries due to peer pressure or fear of exclusion from social activities. Understanding the cognitive development stages and their vulnerabilities helps parents, educators, and healthcare professionals tailor interventions and support measures that align with the unique needs of each developmental phase. Recognizing how these stages can affect a child's response to mTBI not only aids in better diagnosis but also empowers us to create nurturing environments that promote healing. As we embrace this knowledge, we have the opportunity to guide our children safely and effectively through their developmental journeys, ensuring mTBIs do not become obstacles to their potential. Brain plasticity and recovery. In the realm of the developing brain, the concept of brain plasticity stands out as a beacon of hope, particularly when addressing the challenges brought forth by mild traumatic brain injuries, mTBI. Brain plasticity, or neuroplasticity, refers to the brain's miraculous ability to reorganize itself by forming new neural connections throughout life. This flexibility is critical during childhood, a period brimming with rapid development and potential recovery after trauma. Understanding the nuances of brain plasticity can transform the way we approach mTBI recovery in children. Unlike adults, children's brains are actively developing, making them more adaptable to changes. When an mTBI occurs, this plasticity allows the brain to compensate for injured areas by redistributing tasks to uninjured regions. This adaptability can lead to significant recovery, offering a promising outlook for children and their caregivers alike. The ability to adapt also means that interventions, therapeutic strategies, and supportive environments can greatly influence recovery outcomes. Key to harnessing brain plasticity is recognizing that early intervention plays a crucial role. The sooner steps are taken post-injury, the greater the potential for positive outcomes. Whether through cognitive exercises, structured play, or engaging learning activities tailored to challenge and strengthen neural pathways, each step contributes to the healing process. Parents, educators, and healthcare professionals should collaborate to craft and execute plans that encourage neural growth and functional recovery, emphasizing a holistic approach that encompasses the emotional and physical well-being of the child. The journey to recovery, however, is not simply about reconfiguring neural connections. It also involves nurturing a supportive environment that fosters resilience and confidence in young patients. Motivating them through encouragement and unconditional support can significantly impact their recovery process. Children's brains are naturally inclined to adapt to new situations and challenges, so providing them with positive reinforcement can set the foundation for a successful healing trajectory. Yet, brain plasticity also reminds us of the delicate nature of the developing brain. While it offers amazing recovery potential, it also underscores the importance of protecting the brain from repeated injuries, which can undermine recovery efforts. This awareness should motivate caregivers and professionals alike to prioritize safety measures during recreational activities, sports, and other endeavors prone to head impacts. In summary, brain plasticity is a powerful ally in the recovery from mTBI in children. It illustrates a dual narrative of vulnerability and strength, offering a roadmap for recovery that is both scientifically grounded and compassionately executed. By understanding and leveraging brain plasticity, those involved in a child's care can not only instill hope but also inspire a profound transformation in the child's neural landscape, illuminating the path toward a brighter, healthier future. Why early childhood is a critical period for brain health. Understanding why early childhood is such a crucial stage for brain health hinges on the concept of brain plasticity. In these formative years, a child's brain undergoes rapid growth and development, establishing the complex neural networks that will influence their cognitive, emotional, and physical capacities throughout life. This period of heightened plasticity means the child's brain is exquisitely adaptable. It can respond to new experiences and environments with remarkable flexibility, making it a time ripe with potential for both learning and healing. As caregivers and educators, recognizing the power of the developing brain during early childhood empowers us to provide nurturing environments that promote healthy brain development. This understanding underscores the importance of offering diverse, engaging experiences that stimulate a child's curiosity and facilitate robust neural connections. It also means being vigilant for signs of potential disturbances, such as those caused by mild traumatic brain injuries, mTBIs, which can jeopardize this critical phase of growth. Early childhood doesn't just offer an opportunity for growth, it also offers resilience, particularly in the face of challenges like mTBIs. During these years, the brain's plasticity is at its peak, allowing children to recover more effectively from injuries than at later stages in their lives. However, this same plasticity also makes them more vulnerable to potential harm, making early intervention crucial. By addressing mTBIs swiftly and with the appropriate care, we can harness the natural resilience of the brain, ensuring children have the best chances for recovery and continued development. The task, then, lies in balancing vigilance with optimism, understanding that while the early years are fraught with vulnerability, they also present unparalleled opportunities for healing and growth. In these dual roles as protectors and nurturers, we hold the keys to unlocking each child's potential for a vibrant, healthy future. How brain plasticity affects mTBI recovery. The developing brain presents an extraordinary wonder, its plasticity. Brain plasticity, also known as neuroplasticity, refers to the mind's intrinsic ability to adapt, reorganize, and rebuild itself, especially following a mild traumatic brain injury, mTBI. In children, this adaptability showcases a beacon of hope. While a parent or caregiver might naturally worry about the effects of an mTBI, understanding brain plasticity can ease anxieties and guide them on a path to effective recovery strategies. During childhood, the brain is in a state of prolific growth and change. This period of development means the connections between neurons, known as synapses, are rapidly forming and remodeling. When an mTBI disrupts these connections, the brain's plastic nature allows it to devise new pathways. Unlike in adults, children's brains can often compensate for injuries by rerouting functions from damaged areas to healthier ones. This ability is crucial for recovering cognitive and physical skills. The healing process of mTBIs in children is dynamic. It can sometimes surprise professionals and families alike. For caregivers and educators, understanding this mechanistic adaptability informs how they might approach rehabilitative efforts. Targeted activities, whether cognitive exercises, physical therapy, or simply engaging play, can bolster neuronal connections. These connections promote healing and improved functionality, illustrating how engagement in the right kind of activities can make a noticeable difference in recovery outcomes. The critical role of the environment can't be overlooked. A nurturing and stimulating environment doesn't just support the healing brain, it enhances its plastic capabilities. Positive reinforcements, such as encouragement, patience, and a structured routine, help facilitate synaptic growth. This transfer into everyday action is where parents and educators can truly contribute to the recovery journey. Understanding that the environment is an active participant in a child's recovery is empowering for everyone involved. However, while brain plasticity is a powerful ally, it's not a panacea. Each child's recovery journey is unique, filled with triumphs and setbacks. Recognizing the limits and realistic timelines for recovery prevents unrealistic expectations. It also emphasizes the necessity of professional guidance. Healthcare professionals are instrumental in evaluating the extent of an mTBI and suggesting interventions tailored to the child's needs, thereby maximizing recovery potential. Long gone is the belief that the brain is a fixed organ with limited capacity for healing. But parents and caregivers have the responsibility to ensure interventions are timely and appropriate. Quick and consistent action following an mTBI is vital. The earlier the intervention, the greater the impact of plasticity on recovery. This formative guidance ensures children not only recover but thrive. Finally, recovery isn't just about returning to pre-injury states, sometimes it's about overcoming them. This idea might sound profound or even mystical, but it's a testament to the boundless potential of the developing brain. Children growing through the trials of mTBI often develop resilience and coping skills that prove invaluable. The journey of recovery, underscored by the miracle of brain plasticity, can transform adversity into an opportunity for growth, not just for the child, but for everyone supporting them. Chapter 4 Early Warning Signs of mTBI. In children, identifying mild traumatic brain injuries, mTBI, early is crucial. When it comes to young, developing brains, every moment counts. Often likened to slight ripples in water, the effects of an mTBI can be subtle yet significant. Quick recognition of symptoms can make a world of difference, not just in the here and now, but for the child's future development and well-being. Physical signs are often the most immediate indicators of mTBI. Children might exhibit significant changes such as headaches or a wobbly balance. These symptoms can appear immediately or surface after some delay, which makes them tricky to pin down. But it's not just the immediate aftermath that requires vigilance. A child looking perfectly fine today might start showing symptoms weeks later, adding a layer of complexity in catching early warning signs. While many caregivers focus on bumps, it's crucial to stay alert even after just a seemingly harmless fall. School presents its own set of challenges when recognizing mTBI. You might notice a child struggling with tasks they previously found easy. A decline in academic performance can serve as a cue, nudging educators and parents to consider the possibility of a brain injury. Additionally, children may become easily distracted or display uncharacteristic behavior changes in the classroom. Recognizing these signs requires empathy, patience, and, crucially, communication among parents, teachers, and healthcare providers. Ultimately, awareness is the first step toward action. By knowing the early warning signs, we can help children get the care they need promptly. It's an opportunity, really, to reach out and potentially alter the trajectory of a young life. Our collective goal is to empower parents, caretakers, and educators to act knowledgeably and confidently, offering the support these children deserve as they find their way back from mTBI. Physical red flags that may indicate mTBI form a crucial part of understanding how our children's brains respond to injury. Recognizing these symptoms early allows us to tap into the brain's incredible ability to heal itself through neuroplasticity. Brain plasticity refers to the brain's ability to change and adapt, especially when faced with new challenges or injuries. While this presents a powerful opportunity for recovery, it can be a double-edged sword if physical signs of injury go unnoticed. One of the most immediate physical red flags of a mild traumatic brain injury, mTBI, is an unusual headache. These headaches often differ from typical ones in their intensity, frequency, and response to medication. A child may describe it as a throbbing sensation or a pressure-like feeling that doesn't easily go away. Such headaches can be distressing not only for the child but also for caregivers because they often appear without any clear reason or trigger. Another critical sign is sudden changes in balance or coordination. This can manifest as clumsiness, unsteady walking, or difficulty with fine motor tasks such as writing. You might notice that a child who could once ride a bicycle or play sports with ease is now struggling. These changes occur because the areas of the brain responsible for motor skills and balance are sensitive to injury. The good news is that the brain's plasticity allows these functions to improve with timely intervention and therapy. Watch out for increased sensitivity to light and sound, which are common yet often overlooked indicators of mTBI. A bright room might become unbearable, or everyday noises like a vacuum cleaner might seem excessively loud and distressing. Children might shy away from environments they once enjoyed because their tolerance levels have shifted. It's easy to dismiss these signs as temporary discomforts, but they can indicate that the brain is hard at work trying to compensate for areas affected by the injury. It's also important to note any sudden lethargy or changes in sleep patterns. A child who becomes unusually drowsy or struggles to stay awake during the day may be exhibiting another red flag. On the other hand, a child who has difficulty sleeping at night might experience the opposite effect, becoming irritable or less able to concentrate during the day. Such disturbances can signal that the brain is grappling with the aftermath of an injury, trying to restore its rhythm and functionality. Early detection of these physical warning signs is your best ally in nurturing recovery and maximizing the benefits of the brain's plasticity. This allows interventions to be tailored specifically to the child's needs, facilitating a path to healing that the brain is remarkably equipped to travel. The capacity for recovery lies not only in the vigilance of caregivers but also in the amazing adaptability of the brain itself. Your awareness and action can make a world of difference in a child's journey through recovery. Delayed symptoms, recognizing signs weeks after injury. Understanding the complexities of mild traumatic brain injury, mTBI, in children requires patience and awareness far beyond the immediate aftermath of an incident. Sometimes, the signs of mTBI don't surface until weeks later, camouflaged by the child's apparent recovery. This delay can be perplexing but is deeply entwined with the brain's incredible capacity for plasticity, a dynamic ability to adapt and recover over time. In the weeks following an injury, caregivers might notice subtle changes that weren't initially apparent. These changes can include difficulties in attention, challenges in schoolwork, or altered sleep patterns. You might spot a once energetic child experiencing increased fatigue or a normally social kid withdrawing from activities they once loved. Such symptoms can catch parents and caregivers off guard, especially if there was no obvious sign of injury at the time of the incident. Brain plasticity, the brain's ability to modify itself in response to injury, can at times cloud our perception of recovery. While plasticity is a remarkable feature that aids recovery, it can also temporarily mask the full extent of the injury's impact. This means that although a child may seem adequately recovered right after the trauma, delayed symptoms can emerge as the brain continues to adjust and reorganize itself. It can be tempting to ignore these late emerging signs, hoping they fade away. However, recognizing these symptoms early plays a crucial role in ensuring the child receives the appropriate interventions needed for a smoother recovery. Ignoring delayed symptoms can lead to prolonged difficulties that might otherwise be mitigated with timely strategy and support. As children's brains recover and rewire after mTBI, engaging with healthcare professionals becomes vital. They can offer guidance and reassurance while helping to develop strategies tailored to the child's unique recovery path. Moreover, understanding the nature of brain plasticity in conjunction with these delayed symptoms can motivate caregivers to remain vigilant and responsive to changes in their children. In your journey, remember that you don't walk this path alone. With awareness and timely response, caregivers, educators, and healthcare professionals together have the power to significantly influence a child's recovery trajectory. The transformative potential of the brain, coupled with informed care, can lead to outcomes that empower the child and their support network. Recognizing the signs even when delayed equips us not just to react, but to proactively provide support that aligns with the natural ebb and flow of healing. Warning signs in schools are bustling environments where children navigate a complex world of learning, social interactions, and physical activities. But for a child who has experienced a mild traumatic brain injury, mTBI, the challenges may be subtly multiplied. Recognizing these warning signs in a school setting can be critical, as early intervention can harness the brain's plasticity and promote recovery. In the classroom, cognitive issues may surface as the most obvious signs of trouble. A child with mTBI might struggle with concentration or become easily distracted. Tasks that were once straightforward like reading or math problems could suddenly seem insurmountable. Teachers might notice that the student takes longer to complete assignments, requiring more repetitions to grasp new concepts. Even more nuanced are changes in behavior. A child who was previously energetic and engaged might now appear fatigued or lethargic in school. They may become irritable or show disinterest in activities they used to love. These behavioral shifts sometimes manifest as increased emotional sensitivity, with children possibly crying more effortlessly or becoming frustrated quicker than before. Social interactions offer another window into the impact of mTBI. Kids who have suffered these injuries might isolate themselves, avoiding group activities or struggling to keep up with conversations. Previously amicable relationships might fray, leading to tensions with peers or increased incidences of conflict. Let's not overlook the physical challenges that can bleed into the school environment. Headaches and fatigue can make a full school day feel daunting, often exacerbated by the noise and chaos of a busy school. Kids might complain of dizziness or blurred vision, common mTBI symptoms that go unnoticed against the backdrop of a bustling classroom. Addressing these issues promptly can significantly affect the child's recovery path. Brain plasticity, the brain's remarkable ability to adapt and form new neural connections, presents hope. Engaging with educators and healthcare professionals means these signs won't slip through the cracks, allowing for tailored support plan implementation. Parents and educators must work together, armed with empathy and observation. Encouraging open communication with the child can help them express what feels different or challenging. Teachers should be included in this dialogue, as they are often the first line of defense in recognizing shifts in behavior or cognition indicative of mTBI. Incorporating subtle but effective support systems, such as shorter assignments or breaks, can ease the child's academic experience. Understanding, attentive staff can prepare tools or techniques to support concentration or reduce sensory overload, like quiet corners or noise-canceling headphones. These small adjustments, aligned with the understanding of brain recovery principles, can make a big difference in the recovery journey. By remaining vigilant and responsive to these warning signs, educators and caregivers can provide an environment that fosters healing. In empowering one another with knowledge and support strategies, the resilience of a child's developing brain is matched by the resilience of their community. Detection and response to mTBI at school can transform potential setbacks into opportunities for growth and resilience. Chapter 5: Physical Symptoms of mTBI. When a child's vibrant play turns to discomfort, swift recognition can be your strongest ally. Mild traumatic brain injuries, mTBI, often manifest through physical symptoms, a subtle whisper of change that requires your discerning attention. Among these, persistent headaches, dizziness, and balance troubles may become familiar intruders, signaling a call to vigilance. Sensitivity to light and sound, known as photophobia and phonophobia, may also accompany them, leaving your child retreating from what they once eagerly embraced. Coordination challenges can appear, with motor skills feeling just a tad off, as if the body's harmony has temporarily lost its rhythm. By keenly observing these signs, you empower yourself to step in with understanding and action, ready to engage healthcare professionals. Such vigilance helps ensure that recovery isn't left to chance, but rather embraced with intention and hope. Common physical symptoms. When it comes to mild traumatic brain injuries, mTBI, in children, identifying common physical symptoms early can make a significant difference in the child's recovery journey. One of the most prevalent signs that may arise is a headache. Children might not always articulate their discomfort clearly, but watch for signs of persistent headaches following a bump or impact. The key is vigilance. These headaches can vary in intensity and duration, but they often appear consistently or at typical times of day, like after school or physical activity. Another symptom to monitor is dizziness or balance issues. If a child appears unusually off balance or stumbles more than usual, these could signal that something's amiss. It's crucial to pay attention to these changes, especially when they appear suddenly after an incident. Keep in mind that a child might not describe dizziness directly. Instead, they might seem disoriented or unsure on their feet, struggling with tasks they previously managed with ease. Light and sound sensitivity, known as photophobia and phonophobia, can also accompany mTBI. A child may express discomfort in bright settings or complain about the noise in places they once found enjoyable. These senses become heightened, leading to irritability or frustration when exposed to stimuli that weren't problematic before. Family and educators must notice these subtle shifts, as they can be key indicators of an underlying mTBI. Lastly, coordination and motor skills might be adversely affected. You may notice a child having trouble with tasks requiring fine motor control, such as writing or using utensils. Rough and tumble play might also reveal awkwardness or hesitation as they struggle to trust their physical abilities. Understanding these symptoms empowers caregivers to seek timely, expert guidance, ultimately supporting the child's path to healing. Headaches, a common symptom of mTBI, are not just frequent visitors in the world of childhood injuries. They often signal a more serious concern lurking beneath the surface. When we talk about mild traumatic brain injuries, mTBIs, headaches are one of the most common symptoms, acting as the body's early warning system. They can vary in intensity, duration, and type, offering various clues about the underlying effects of the injury. While many might dismiss these headaches as a run-of-the-mill ailment, their recurring nature post-injury demands a deeper look. In the context of mTBI, headaches can manifest in several forms. From the sharp and sudden pangs to dull, persistent aches, understanding each type requires attention and patience. These headaches can disrupt daily activities, and for children, they might affect everything from school performance to playtime. It's important to recognize that kids might not always articulate the full extent of their pain. Observing their behavior, are they squinting, rubbing their foreheads, or lying down in dark rooms, can provide essential insights. Addressing these headaches is crucial not just for immediate relief, but also for the long-term healing process. Early intervention and appropriate strategies, such as consulting with healthcare providers, setting a regular sleep schedule, and encouraging proper hydration, can mitigate the frequency and severity of headaches. Ultimately, dealing with headaches after an mTBI isn't just about alleviating physical discomfort. It's about empowering children and caregivers to take proactive steps, fostering an environment of understanding and care that champions recovery and well-being. Dizziness and balance issues delve into some of the most unsettling symptoms that can arise after a mild traumatic brain injury, mTBI, in children. Imagine standing up and having the world spin around you, or feeling like you've lost your footing on solid ground. For children who are still learning the complexities of motor coordination, these symptoms can add a layer of confusion and anxiety to their everyday experiences. When a child struggles with dizziness or balance challenges, it's often due to disruptions in how the brain processes sensory information. This can affect their ability to engage in normal activities, from playing at recess to focusing in the classroom. Dizziness may manifest as lightheadedness or the feeling that one's surroundings are moving. Balance issues can make simple actions, such as walking or standing, suddenly feel daunting. Encouraging open communication with kids about how they're feeling can make it easier to pinpoint when these issues are occurring. As caregivers and educators, recognizing the signs early on and taking them seriously can substantially impact a child's recovery and comfort. If a child displays persistent dizziness or struggles with balance, creating a supportive environment becomes essential. Temporary modifications, like minimizing potentially dangerous physical activities, can prevent further injury while they heal. Motivating children to express their experiences and reassuring them that it's a normal part of recovery can help alleviate any fears or misconceptions they might have. Monitoring these symptoms and understanding their nuances requires empathy and patience. By paying heed to even the subtle signs, caregivers can better advocate for the timely interventions that children need. Ensuring children don't feel discouraged or isolated in their journey back to wellness encourages resilience and promotes a nurturing path to recovery. Sensitivity to light and sound, photophobia and phonophobia can be particularly challenging symptoms for children experiencing mild traumatic brain injuries, mTBI. Imagine a situation where a child, typically full of energy, suddenly finds common lights and sounds overwhelming. Photophobia, sensitivity to light, and phonophobia, sensitivity to sound, often accompany mTBI. These reactions are uncomfortable and can exacerbate other symptoms like headaches and nausea. In a classroom, the hum of fluorescent lighting or the clamor of chatter can become unbearable for a child dealing with these sensitivities. At home, the television or even the clink of silverware might become a trigger, leading to avoidance of environments previously enjoyed. Such reactions can be frustrating for both the child and those around them, making it crucial to recognize and validate these symptoms early on. Encouraging children to communicate their discomfort is essential. Young kids might struggle to articulate their experiences, so observing behavioral cues is key. Perhaps they squint more frequently, cover their ears, or become unusually withdrawn. Empathy is vital. Acknowledging the genuine nature of their discomfort and not merely passing it off as oversensitivity can foster trust and understanding. Simple measures such as dimming lights, prioritizing quiet spaces, or allowing the use of sunglasses indoors can offer significant relief and facilitate healing. Remember, you're not alone in this journey, nor is the child who's facing these hurdles. It requires a supportive approach. With awareness and proactive adjustments, children can navigate these challenges, ensuring that they don't feel isolated or misunderstood in their daily environments. Ultimately, these small yet impactful changes can be instrumental in not only addressing the sensitivity itself, but also in aiding a smoother recovery from mTBI. Coordination and motor skill. Within Chapter 5, as we explore the common physical symptoms of mild traumatic brain injuries, mTBI, there is a profound need to address how these injuries can affect a child's coordination and motor skills. This impact often manifests in the most subtle ways. Perhaps a child who used to effortlessly ride a bike now struggles to maintain their balance, or the young student who once excelled in gym class now finds themselves reluctant to participate. These changes might seem minor, but they hold the key to recognizing an mTBI early. For caregivers, parents, educators, and healthcare professionals, understanding these nuances is crucial. One of the challenges is that these motor skill disruptions aren't always immediately noticeable. Instead, they can evolve slowly, drawing attention only when a child repeatedly trips over their own feet or drops objects more frequently than before. In a school setting, you might see this impact in a child's handwriting or their ability to complete tasks requiring fine motor skills, like tying shoelaces. Observing these patterns is vital, as they signal underlying neural disruptions caused by the injury. It calls for an empathetic approach without judgment to encourage children to express their struggles openly. While the consequences of mTBI on coordination can be overwhelming, they also provide a path towards healing and recovery. By incorporating targeted therapies and exercises, children can regain their motor skills and confidence. This journey requires patience and collaboration among parents, educators, and healthcare providers, reaffirming the child's worth and potential at every step. Let's commit ourselves to stay vigilant, recognizing that even the slightest change in coordination could be a cry for proactive intervention. With the right support, the path to recovery and normalcy is not only possible but also promising. Chapter 6: Emotional and Psychological Effects. In the journey of addressing mild traumatic brain injuries, mTBI, in children, the emotional and psychological nuances often gently unveil themselves, demanding a delicate touch of understanding and compassion. These subtle yet profound effects might manifest as anxiety, depression, or emotional swings, reshaping the child's landscape of mood and personality. It's essential to recognize that such emotional aftershocks aren't just residual tremors, they are intrinsic parts of the healing mosaic, impacting a child's sense of self and well-being. Parents, educators, and caregivers find themselves in a unique position to offer reassurance and stability, nurturing the child's innate ability to adapt and grow. By fostering a secure environment where children feel heard and supported, we empower them to navigate through these complexities. It's through empathetic listening and mindful engagement that children can reclaim their emotional equilibrium, progressing on a path of healing where hope and resilience flourish. As we grasp the importance of early intervention and support, let us be inspired to weave a net of awareness and action, a net strong enough to catch the delicate, transformative threads of these young lives. Emotional reactions. Unlocking the emotional landscape following a mild traumatic brain injury, mTBI, can feel daunting, yet understanding is the first step toward healing. Children often experience a whirlwind of emotions during recovery, which may manifest as anxiety or mood swings. These reactions aren't just fleeting feelings, they signal deeper psychological impacts that follow an mTBI. Recognizing these signs early can pave the way for effective interventions and support. In the aftermath of an mTBI, children might display heightened sensitivity and emotional reactivity. This could surface as irritability or increased frustration over seemingly trivial matters. Parents and educators might find themselves facing a child who lashes out unexpectedly. It's crucial to remember that these emotional outbursts are not deliberate misbehavior but rather a result of the brain's struggle to process emotions effectively. Providing a safe and understanding environment is key to helping children navigate these turbulent waters. Additionally, the journey through emotional recovery isn't a linear path, and each child will process their experience uniquely. It's not unusual for a young person to feel a sense of detachment or emotional numbing as they cope with their new reality. Encouraging them to express their feelings through words, art, or play can be immensely therapeutic. This kind of expression not only aids in emotional release but also empowers children, giving them a sense of control amidst the chaos. Parents and caregivers play a vital role in monitoring and nurturing emotional well-being. Open communication and active listening can make a significant difference, providing children with the reassurance they desperately need. Remember, fostering resilience is a powerful tool for both the child and their community. As we collectively champion understanding and compassion, we nurture a space where healing and growth are possible. Anxiety and depression in children after mTBI can be deeply unsettling for both the child and those who care for them. When mild traumatic brain injuries occur, they can disrupt the emotional equilibrium of children, leaving them vulnerable to anxiety and depression. These emotional reactions often appear as changes in behavior, mood swings, or newfound fears. It's not uncommon for children to experience underlying feelings of sadness or worry that weren't evident before the injury. In the aftermath of an mTBI, children may struggle with a sense of uncertainty. They might grapple with anxiety about returning to school or engaging in activities they once loved. This anxiety can stem from a fear of re-injury or feeling incapable of performing at prior levels. As a parent or caregiver, it's essential to acknowledge these feelings and validate the child's emotions, creating a supportive environment where they feel understood and safe to express their concerns. Depression might manifest in children as a withdrawal from friends and activities, noticeable changes in appetite or sleep patterns, and a general lack of interest in everyday activities. Recognizing these signs early is crucial. A proactive approach, including open communication and reassurance, can make a significant difference. Encouraging children to share their thoughts and engaging them in gentle, supportive conversations can help mitigate these emotional challenges. Empowering children during this recovery phase involves patience and understanding. By fostering a nurturing atmosphere and being attentive to shifts in mood, caregivers can facilitate healing and resilience. Professional support, such as counseling or therapy, might be necessary to address significant anxiety or depression. Remember, recovery is a journey, and with time, care, and attention, children can regain their emotional balance and thrive once more. Irritability and aggression, emotional dysregulation are common emotional reactions following mild traumatic brain injuries, mTBI, in children, yet they often surprise or even alarm parents, educators, and caregivers. Kids who were once calm and collected may suddenly become quick to anger or display bouts of irritability. This is not only distressing for adults who care for them but also incredibly confusing for the children, who may not understand why they're feeling this way. When the brain sustains a mild injury, its regulation of emotions can become disrupted. In turn, this disturbance often manifests as irritability and aggression. The brain is busy trying to heal itself, yet the emotional centers are out of sync, creating an emotional roller coaster that is hard to control. Unlike physical injuries, the emotional scars aren't visible, so it's crucial for those caring for the child to recognize these signs as part of the healing process. Education and awareness can gently guide these emotional storms toward calmer skies. Empowering children to express what they're feeling and teaching them coping strategies can work wonders in calming the tide of emotional dysregulation. Simple exercises in deep breathing, mindfulness, or even creative outlets like drawing or writing can redirect this disruptive energy. It's not just about fixing the immediate symptoms, it's about equipping them with lifelong strategies to manage emotions. This gentle yet effective approach helps children navigate their emotional worlds with greater ease and confidence. In the journey of recovery from an mTBI, remember, compassion and patience are your greatest allies. Armed with understanding and care, you can help make the world a less confusing place for these young ones, giving them the supportive space they need to heal emotionally. Their resilience, combined with your nurturing support, can rebuild the bridges to emotional wellness, leading to brighter days ahead. Personality and mood changes. The gentle dance between personality and mood whispers to us more softly post-injury, yet its echoes are profound in the lives of children grappling with mild traumatic brain injuries, mTBI. In the heart of mTBI's emotional labyrinth, mood swings and personality shifts emerge not merely as symptoms, but as transformative experiences that can bewilder both the child and those around them. Understanding this subtle metamorphosis is crucial, as these changes can alter how a child connects with their world, potentially reshuffling the cards of their emotional deck. A child's personality is a tapestry woven from countless threads, each colored by temperament, experiences, and brain function. An mTBI can tug at this tapestry, unthreading what may have seemed a seamless weave. You may observe a once vibrant child withdraw into themselves, the joyful laughter giving way to an unsettling silence or uncharacteristic irritability. For parents and caregivers, these shifts can be equally disconcerting and heart-wrenching, rendering home and school interactions challenging. It's essential to create a supportive environment that acknowledges these changes without judgment, fostering a space for healing and understanding. One of the most puzzling aspects is the unpredictability of these mood changes. One moment, a child may display exuberant enthusiasm, while the next might find them sinking into despondency or struggling to manage a burst of anger. These emotional waves aren't just random fluctuations, they can be intricately linked to the neurochemical shifts occurring within the healing brain. This neurochemical imbalance may lead a child to feel emotions more strongly or, conversely, to experience a dulled emotional response. It's important for caregivers to remain patient and view these emotional states through the compassionate lens of healing rather than defiance or misbehavior. Surviving an mTBI doesn't have to mean surrendering to it. Empowering children with the ability to articulate their feelings and fostering an environment where their voice matters is vital. Practicing mindfulness techniques, encouraging creative expression, and engaging in supportive dialogues can anchor a child's emotional compass. Collaboration with mental health professionals can bolster these efforts, guiding children and their caregivers through tailored therapeutic pathways designed to reclaim balance and emotional stability. Yet, healing is a journey marked by compassion and resilience. Each child's path through moods and personality shifts post-mTBI is unique and may reveal new strengths and facets previously unexplored. By recognizing the fluid nature of personality and mood after injury, caregivers can inspire confidence, fostering a belief in the child's capacity to transform challenges into opportunities for growth. Through patient understanding and unwavering support, we can accompany our children as they navigate the complexities of their evolving selves, guiding them gently back towards the light of stability and emotional wholeness. Emotional numbing and detachment in children following a mild traumatic brain injury, mTBI, can be an overlooked yet significant aspect of recovery. When a child begins to show signs of emotional numbing, they might appear distant, withdrawn, or less responsive to situations that once sparked joy or concern. This disconnection from emotions can be unsettling for parents and educators who are eager to support the healing process. It's crucial to recognize these changes as potential indicators of an mTBI, even if the injury seemed minor at first. In some cases, emotional blunting can manifest as a protective mechanism. The brain, overwhelmed by the injury, may suppress emotional responses to shield the child from distress, leading to this sense of detachment. While this might seem like an adaptive response, it can hinder emotional development if not addressed. Teachers might notice students who were previously expressive become unusually quiet or disinterested in classroom activities, which could affect learning and social interactions. Active observation combined with empathy can open doors to essential conversations and interventions. Healthcare professionals emphasize the importance of creating an emotionally supportive environment for these children. Encourage them to express what they're feeling, even if it comes out in small, seemingly insignificant gestures. The goal is to slowly reintegrate emotional experiences and provide reassurance that their feelings, whatever they are, matter. This supportive approach can nurture a child's emotional world back to health, ensuring they feel seen and heard during a challenging time. Timely recognition and appropriate response are key in transforming these emotional challenges into opportunities for growth and resilience. By acknowledging and addressing emotional numbing, we empower caregivers to be instrumental in their child's holistic recovery journey. Chapter 7: Seeking Professional Help, When and How. Recognizing when to seek professional help for a child suspected of having a mild traumatic brain injury, mTBI, can be a crucial turning point in their recovery journey. It's essential to trust your instincts while being guided by awareness and knowledge. If a child's symptoms are persistent or worsening, it's critical to consult healthcare professionals who specialize in pediatric brain health. Pediatricians, neurologists, and neuropsychologists possess unique expertise that can offer a comprehensive, nuanced evaluation of your child's condition. They can help determine the extent of the injury and outline a path for recovery that aligns with your child's individual needs. Moreover, asking the right questions about the evaluation process can empower parents and caregivers to make informed decisions. Engaging these professionals early in the process is a vital step toward safeguarding not just immediate well-being but also the future developmental trajectory of the child. By being proactive and informed, you can transform uncertainty into an opportunity for healing and growth. Evaluation and diagnosis. Recognizing when a mild traumatic brain injury, mTBI, requires professional evaluation can be a crucial step toward ensuring a child's full recovery. It's important to observe the child's behaviors closely and trust your instincts. If something feels off, you're the best advocate they've got. Quick action can significantly impact outcomes, so don't hesitate to reach out to health professionals if you notice any worrisome signs. Conducting an mTBI evaluation typically involves a comprehensive assessment by specialized practitioners like pediatricians, neurologists, or neuropsychologists, who will use a variety of diagnostic tools tailored to children's unique developmental needs. Through a guided exploration of symptoms, history, and potential impacts on daily activities, these professionals aim to illuminate the path forward. By asking pointed questions and remaining actively engaged, caregivers can ensure their children receive the attention they deserve, setting them up for the brightest possible future. How to determine if professional evaluation is needed. Knowing when to seek a professional evaluation for a child potentially dealing with a mild traumatic brain injury, mTBI, can be a pivotal step in ensuring their well-being. It's crucial to understand that not all bumps and falls warrant immediate medical attention. However, there are specific circumstances where erring on the side of caution becomes a beacon of wisdom. These moments, seemingly small and momentary, could unfold into opportunities for healing and understanding when addressed promptly. Parents and caregivers must watch for signs that could indicate the need for professional attention. Changes in a child's physical, cognitive, or emotional well-being that persist or intensify should act as red flags. If a child exhibits symptoms like persistent headaches, uncharacteristic irritability, or noticeable shifts in focus and memory, it's time to consider an evaluation. An injury may seem mild initially, but lingering or worsening symptoms could mean deeper evaluation is necessary. Sometimes, the subtler changes, the ones that hide in plain sight, signal a need for a professional glance. An important factor is the context of the injury. If a child experiences a significant impact during sports or an accident and shows any immediate symptoms like confusion or dizziness, reaching out to healthcare providers becomes crucial. The key is recognizing when the usual behavior feels off compared to the child's norm. Don't underestimate your instinct as a caregiver. Sometimes what you can't quite put a finger on is the body's quiet plea for expertise. Ultimately, the goal isn't just to treat but to understand. Professional evaluations aren't just about diagnosing but about empowering insight into the next steps for recovery. This means paving the way for informed decisions that foster the child's potential and safety, leaving no room for unchecked uncertainties. In these moments of concern, seeking professional insight isn't an admission of defeat but a commitment to the child's best future. What to expect during an mTBI evaluation. In the process of understanding mild traumatic brain injuries, mTBI, in children, an evaluation is a crucial step. But what exactly should you expect during this assessment? Knowing what to anticipate can ease anxiety for both you and your child, allowing you to focus on the path to recovery. The evaluation typically involves multiple stages, each designed to provide a well-rounded understanding of your child's condition. First, prepare for a comprehensive medical history review. Professionals will want to know all about previous injuries, family medical history, and developmental milestones. It's vital to be as detailed and honest as possible, as this information forms the baseline for understanding the current situation. Expect questions that might seem exhaustive, but remember, they are crucial for tailoring a personalized care plan. The next step often involves physical and cognitive examinations. These tests assess your child's motor skills, coordination, and cognitive functions like memory and concentration. Tests might include tasks that check balance or reflexes, as well as simple cognitive tasks tailored to your child's age. While these exercises may seem daunting, they are essential in painting a complete picture of your child's health. Finally, professionals might suggest neuroimaging techniques like MRIs or CT scans, especially if there's a need to rule out more severe issues. However, these aren't always necessary for diagnosing mTBI. The primary aim of these evaluations is to determine the extent of the injury and the best course of action for your child. By knowing what to expect, you become an empowering force in your child's diagnosis and recovery journey. Pediatricians, neurologists, and neuropsychologists who to consult. Navigating the world of medical consultations can be daunting, especially when it comes to the delicate complexities of a child's brain. Choosing the right professional to consult can feel like a significant decision, one that hinges on understanding the roles pediatricians, neurologists, and neuropsychologists play in evaluating and diagnosing mild traumatic brain injuries, mTBI. Pediatricians are often the first point of contact when there are concerns about a child's health. These doctors have a broad understanding of child development and are skilled in recognizing potential red flags related to mTBI. They're well-equipped to initiate the assessment process and may perform preliminary tests to gauge the extent of the injury. If you're uncertain about which direction to take, consulting a trusted pediatrician is an excellent first step. They can guide you on whether further specialist intervention is necessary and provide ongoing care. When the situation calls for more detail, neurologists step into focus. These specialists dedicate their practice to conditions affecting the nervous system, which includes the brain and spinal cord. Neurologists can offer in-depth evaluations and have the tools to explore the neurological impact of an mTBI. They might conduct imaging studies like MRIs or EEGs to get a detailed picture of any brain changes resulting from the injury. If your concerns persist beyond the primary care stage, a neurologist may be the logical next step. They bring a depth of expertise that can offer clarity and reassurance. Neuropsychologists offer a unique perspective on brain health by assessing how an injury affects a child's cognitive, behavioral, and emotional functions. They can conduct detailed assessments that help to map out the injury's longer-term effects on learning and behavior, which is particularly useful if the child struggles with tasks that were previously manageable. Moreover, neuropsychologists can provide therapeutic interventions and strategies that support recovery and adaptation, tailored to the child's specific needs. Their role becomes vital if cognitive impairments or emotional changes become evident after an mTBI. Deciding who to consult isn't always clear-cut, but understanding the roles these professionals play can guide you toward the best path for your child. Pediatricians provide a comprehensive starting point, neurologists dive deeper into the brain's physical health, while neuropsychologists embrace the intertwining of cognition and emotion in the healing journey. Collaboration among these professionals can create a support network that wraps around your child, ensuring that all aspects of their recovery are addressed. Each professional brings a crucial piece to the puzzle, working collaboratively to ensure your child receives holistic care. Engaging with them prompts a collective effort that embraces not only the brain but the child as a whole. When it comes to seeking professional help for mTBI, understanding who to approach and when could empower you to make well-informed decisions that profoundly impact your child's journey to recovery. Questions parents should ask health professionals as you navigate the complex world of mTBI evaluation and diagnosis. It's crucial to approach health professionals with questions that elicit clear, informative answers. What symptoms should raise a red flag, prompting immediate reevaluation or alteration of the treatment plan? By beginning with these kinds of inquiries, you're laying the groundwork for a thorough understanding of your child's condition and the path forward. Understanding why specific tests are recommended can clarify the diagnostic process. Ask health professionals about the purpose and expected outcomes of assessments such as neurological exams or imaging studies. This will help demystify the process and enable you to make informed choices about your child's care. Additionally, inquire about potential risks and benefits associated with each test, ensuring you're well-versed in the implications of the evaluation methods chosen. Another essential aspect to grasp is how the professional will interpret the results of these evaluations. What does a particular score or finding mean for your child's immediate and long-term care? These interpretations directly influence treatment decisions, so ensure you understand how conclusions are reached and what they entail for your child's recovery journey. Finally, consider asking about the expected progression and recovery timeline for your child's specific case. Every brain injury is unique, and it's vital to have realistic expectations about the recovery process. Understanding the recovery milestones helps in planning support systems and adjusting day-to-day activities to encourage healing. Engaging with health professionals through these strategic questions not only enhances collaboration but also empowers you to advocate effectively for your child's well-being. Conclusion: recognizing and responding to mild traumatic brain injuries in children requires a compassionate and informed approach, and our journey through this book has hopefully equipped you with the tools to make a difference. Understanding the subtle yet significant cues of mTBI not only empowers us to act swiftly but also underscores the profound responsibility we have as caretakers of our children's cognitive and emotional health. The early recognition of mTBI symptoms leads to timely intervention, setting the stage for recovery and resilience. As we've explored, the developing brain possesses remarkable plasticity, offering a window of opportunity for healing when supported by appropriate care and resources. By embracing knowledge, we foster an environment that nurtures recovery and growth, unlocking the potential for each child to thrive despite the challenges posed by mTBI. Together, let's commit to being vigilant guardians of our children's well-being, advocates for their care, and champions of their boundless ability to adapt and recover, ensuring they step into their futures with strength and confidence.